Hello, everyone. Good. This is Dr. Khan, Executive Plastic Surgery, Michigan. So I have a 64-year-old patient. She got her first set of implants in 1989. Then 2 years later, the whole Connie Chung slash ban on the implants occurred. And then she ended up getting an explant, and the capsules were left behind. These were the silicone implants that were banned in 1992. Now, from 1991 onward till the year 2000, she lived without any implants since she had explanted. And then she decided to get a set of silicone implants. Remember, back then, the year 2000, the silicone implants were still banned. You could get them under experimental reasons. And so she ended up getting her second set at that time. So she has had implants now for 23 years. So she came to me with pain on the left side, grade 4 contracture on the left side, and a grade 3 contracture, and a lot of hurt and misery from these implants. She was not at all happy. She was restricted and limited with her movement. So as you will see, if you look, now she also, when I talked to her, she also got an MRI, and again, I could tell it's still proven otherwise. Now you can see this was below the muscle, and you can see some areas where the implant is literally what is excavating out right here. You can see the extension right here, and we will see complete end block on the right side. This is the right side. And then, so the question that I got asked yesterday was, how am I able to microscopically? Obviously, microscopically, I cannot because I don't have a microscope during the surgery. But as you can see, all of the badness, that quote rupture, which is what it is consistent with, is all contained, and all the inflamed tissue that I feel that's abnormal, hard and thick, is removed. So having been in the OR, you can see, look at the color of this fat. It's nice, bright yellow. This is the excess skin that I remove to help with the contouring. Look at this fat. This is unhealthy, right? This is supposed to be fatty tissue. Look, it's dusky, and it has this different scar consistency. So I remove some tissue on the side and periphery, which is going to go. This is good fat. This is bad fat. And as a plastic surgeon and a surgeon in the operating room since 1998, I can tell by touch, by palpation, and by visualization the consistency of the abnormal tissue. Look, this is bad fat, right? You can see it feels different and looks different, and the color is different and has a different texture to it. This is very healthy fat, what we're used to seeing in normal specimens. So there is no microscope to delineate, but certainly the entire capsule kind of along with the tissue. Remember, the silicone is leaching. So silicone leaches into, from even intact saline implants, it leaches from silicone implants, and certainly from ruptured silicone implants a lot more. And this is what Dr. Henry Dyckman has stated, and I see this in my practice as well. So a new implant from day 1 to day 6, day 7 is kind of, again, more contained, it's more fresh, more new, less chances for rupture. The longer it stays in the body, the higher the chance for rupture, the higher chance for disintegration and focal leakage. In this case, she had an MRI that showed right rupture and also a left rupture. Now, this is where under the muscle, very tedious dissection, very challenging. And the goal of the surgery is to remove all of that capsule plus the implant. And as you saw yesterday, the capsule is made up of 3 layers. To get all those 3 layers plus that inflamed tissue, I don't want to leave this fat behind. And the next thing you know, this continues to hurt the patient. So as you will see, what I'm going to do next is I'm going to go ahead and cut this open. And all of this has been removed, and all inflamed tissue has been removed along with this capsule. So as I cut open, just like what is the MRI showing and the length of time, this is indeed what is a ruptured implant. And look at this, all contained. None of this spilled into the chest. And as I pull this out, you will see, look at this. And it's been there for some time, I can tell. And she's been hurting for some time. And this is where clearly, as you will see, implants are not meant to be in the body forever. Now, if you look at some of this, there's like a brown tinge to this, right? So the pathologist is going to look at it. Look at this. This is all like literally none of this spilled into the, this is like kind of honey, right? So none of this spilled into the chest and there is no reason to quote microscopically remove. And we know this, be it a small capsule or a thick capsule, all of this tissue, if this spills into the chest, don't tell me there were some surgeons saying that it's okay if this spills into the chest. No, this is the, look at the composition of this silicone. It is made up of all these heavy metals, platinum, God knows what else. This is sand, and again, a lot of different dangerous chemicals. You don't want this to spill into the chest. And look at the inside, the consistency, be it a small capsule or a thick capsule. All of this is contained, none of this spilled into the chest, and we will see how the patient bounces back. Now, in the meantime, you can go ahead and focus on this, the Con procedure, twilight anesthesia, where the patient is very comfortable and very safe and very effective. No drains, no need for a lift. Actually, the 64-year-old patient is doing very well. When I cut out that excess skin, the pathologies, the capsules are always sent to pathology to rule out the BIA, ALCL, the squamous cell cancer, amongst any other malignancy. Yesterday, there was a patient where the pathologist called me and there was concern for what is atypical, i.e. breast cancer. So she's going to be going to the breast cancer. You never know what's going to be removed, and that needs to be sent to the pathologist. Microbiology cultures for aerobic, anaerobic, and fungal. I take pictures and video of the chest showing complete removal of the whole capsule and implant, and then I return the implants always to the patient. In this case, they will be returned to the patient. Now, the other thing I want to show here is, if you look carefully, look at this over here. So the fascia of the intercostal has been removed. This is the rib, by the way, rib. The fascia of the intercostal is right here, by the way. You see this? This is the fascial layer. You can see the shiny. And then you got the perichondrium, which is the cartilage off of the rib. In order for me to remove this without the silicone spilling into the chest, again, I'll say this, the cartilage that's directly on top of the rib was removed. You can see how hard this is. This was removed along the fascia of the intercostal, and then another cartilage, and this is the periosteum, the fascia of the serratus anterior, the fascia of the pectoralis minor, all of that is removed. Now look at this abnormality. So this, look at this, how hard this is, right? Now I'm going to cut through this. So all inflamed tissues removed. One of the patients asked, oh, you remove, like from, I believe this patient was asking from Italy, last week when I did the Facebook Live, oh, why do you remove this tissue? This tissue is very hard, unhealthy. Look, as I cut through it. This is silicone. Look, what could be a better example than this? Do I want to leave the silica behind? Look, it's extravasation of the silica, and look, the rest of this is intact. And this is abnormal. Look, I have not even cut open the capsule, right? So this is the point. This is the take-home message. The entire implant, capsule, plus all that inflamed tissue, such as this, needs to be removed. And imagine I left this behind. The patient's going to continue to hurt. You have some Facebook owners, unfortunately, they have no medical knowledge. They say, oh, the capsule needs to be as thin as possible. That's the sign of a good surgeon. No. I conclusively, and I have the histologic evidence from yesterday's paper, and then looking at this grossly and the many pathology specimens, all of this needs to be removed such that none of this remains behind, and the patient gets the best chance to bounce back to a normal state of good health. So now what I'm going to do is, look at this, all this tissue right here. So what I'm going to do now is, I'm going to go ahead and open this end block. None of this spilled. This is all grossly. Remember, surgery is, any tissue that's inflamed is removed. If there is a doubt, remove it, because you don't want to leave that behind, and the next thing you know, the patient recovers only 60%, 70%. You want the patient to remove 100%. So as I cut this open, look, another ruptured implant, as seen on the MRI. Look at the disintegration right here, and again, you can see this, what is this brown type of a pattern appearance, right? And you don't want any, if this spills into the chest just once, and look at this, this has a gray, dark consistency. It's not like the clear capsules like we have seen. So the pathologist is going to look at it, make sure that there is no cancer, lymphoma, malignancy. All of this was contained. And look at this area that I was trying to cut into. This is the extravasation right here. And this is the focal area with that capsule. Now look, some of these areas are so thin. You can see my green glove, and the whole here is to remove all of this, such that none of this spills into the chest. Because once this spills into the chest, you're going to have continued lingering problems. I don't care, you have a drain for 2 or 3 weeks, that's not going to help. You have washing out of the chest with 10 liters of normal saline, that's not going to help either. You have to do it right, where grossly the entire implant, capsule, all of that inflamed tissue is removed. Now what's interesting is, if you see those silicone particles, they're slowly leaching despite this capsule barrier. They're leaching still into the lymph nodes. And we know this in the many patients where they have intact saline implants and they had found silicone inside the lung tissue, for example. Or in the other patient that had a rupture, the silicone was found in the many other organ tissues of the body, like the spleen and the nerve tissue. And this tells you that, just like Dr. Atul Mehta from the Cleveland Clinic, the pulmonologist who I did the Facebook Live a couple of years ago, clearly stated, this goes into the bloodstream, this gel bleed, and this is what's responsible for what is breast implant illness, the toxicity, that's the silicone that travels within the blood. So again, the goal here is to remove the entire implant capsule plus all inflamed tissue, and this needs to be sent to pathology, microbiology. This is not the time to be doing a lift. You can imagine how inflamed the tissue is on the chest. This is not the time to be doing a lift, and I'll tell you, this 64-year-old lady, from my experience, 90% confidence, she will not need a lift and she'll be aesthetically very pleased. Very nice lady from the Midwest. So there you have it. This is Dr. Khan. Please share executive plastic surgery.